Thank you, sir. Uh, Very good morning to all of you. Today I am going to present family and social theories of schizophrenia. Before starting this presentation, why family and social theories of schizophrenia is very important? Because these theories usually help us to make diagnosis as well as psychiatric and psychosocial management to the patients. So understand the family. Family is an exclusive group of people who share a close relationship. A unit typically composed of a mated couple and their dependent children in co-residence. The word family came from the Latin word which means familiar. And there is n number of family types like single parent family, joint family, matriarchal family, patriarchal family, etc. Coming to the early understandings of schizophrenia. Before coming the family theories, many theories concerning the role of family in the schizophrenia has been formulated. In the early 1930s, Sigmund Freud considered schizophrenia as an organic brain disorder. And Harry Stack Sullivan also thought that schizophrenia was a result of continuous stress was caused by adaptation difficulties. Later, emerging new theories of schizophrenia understand better as to help us family functioning as to do psychosocial management also. Family psychopathology. It is different from descriptive psychopathology. Family psychopathology implies various risk situations such as dysfunctional family structure, dysfunctional family functioning, and family relationship, communication pattern, etc. The role of family in mental disorders has been classified into three broad headings such as predisposing role of the family, maintaining factors of the family, therapeutic role of the family. The family psychopathology also important which help us, example, is there any problem in diagnosis, open diagnosis patients, the family psychopathology help us to understand better the patient's diagnosis as well as management aspect. Double bind theory. A double bind is a dilemma in communication in which an individual received two or more conflicting or mutually opposing messages simultaneously. Here, one message negates the other. This theory helps to extend the general system theory in social sciences. This theory given by Gregory Bateson to explain the etiological role of family in schizophrenia. Bateson said family can be understood on two levels. Family is a substantive nature information changes as well as assumptions which underline between the relationship of the participants. The second level also referred as to as meta communication. There is an example for the double bind theory. Someone says I love you but in a hateful way. A mother will ask for a hug but pull away. The child is placed in moving scenario. And third example, mother to son, I hate you, you are such an angel. There is one more example also. The mother's parent says, please provide toffee to all the children. The child also distributed the toffees to the children. Then suddenly parents asked to the children, why did you give all the toffees to the children? These are the conflicting messages creating the confusion to the children and the family members also. Pseudomutuality. Pseudomutuality concept it refers to quality of relatedness with several ingredients. Each person brings into the relation a primary investment in maintaining a sense of relation. Adults' isolation from or failure in other relations because of personality or situational difficulties, or in children painful early experiences of separation anxiety. In the concept of pseudomutuality, here there is a reciprocal mutual concern happening between the patient and the spouse and their spouses. Also, this emphasizing predominant absorption in fitting together at the expense of the differentiation of the identities of the person in the relation. What are the characteristics seen in the pseudomutuality? There is a persistent sameness of the family rule, such as physical and situational alterations. Despite changes occurs in the family, what is going on being experienced in family life. And there is a disability seen in the family role structure and the appropriate role also seen. But There is a absence of spontaneity seen in the role structure, communication, and leadership, etc. Like novelty, humor, and zest in the participation aspect. There is a evidence of intense concern over possible also seen in the family relationship. There is independence from this role structure. What is the pseudo hostility? Pseudo hostility. It was the series came from the Lidman Wine in the year of 1961. He used the term to mean a shared defense against recognizing feelings of tenderness, affection, or sexual attraction, but the therapist uses it here to mean the expression of hostility, which serves as a mask for a more pervasive, deeper lying hostility. A pseudo hostility also may be directed by one family member against another family members, and the children not really feel the great animosity, but the later is a convenient scapegoat. Example, 30 years old client physically abused, but as a child, abused as a child by her father. She says she is not angry with him, and in fact, she has kept a close relationship with him over years. She sees him often. Says she intends to continue doing so. Here, there is a emotion like a negative emotion seen by forbidden from the parents towards the children. Schizophrenogenic mother. The term schizophrenogenic mother is a negative stereotype found in the psychiatric literature between 1950s to 1970s, which refers to mothers of individuals who develop schizophrenia, the implication being that mother has induced the illness. The term coined by Freda from Richmond, and she written that the schizophrenic is painfully distrustful, resentful of other people due to the severe warp and rejection he encountered in important people of his infancy and childhood. As a rule, mainly schizophrenic mother. This theory comes from the maternal causation theory of schizophrenia, and the context of this theory was the belief that early child-mother interactions exerted primary determining effect on later psychopathology. There is examples related to this theory, like the mother is overprotective but subtly rejecting also and subjugating herself towards the children. There is a passive husband seen in the family, according to this theory. Absence of adequate controls in the family, failure to consider the role of child development, dominant behavior seen in the mother. Schism and skew. Theodore Leeds and Lead Ruth in the year of 1957 elaborate the theory of the marital schism and skew. The theory also says that the schism, here you can see that this schism always happened to the father to daughter, and the skew also happened between the mother to son. The theory also systematically studied the characteristics of schizophrenic families using a psychoanalytic oriented psychodynamic perspective. Their main emphasis was on the triadic and dyadic relationship in the families. The schism also, there is a prominent power struggle between the parents, and one parent gets overly close to a child of the opposite sex. The other type of skewed relationship also seen says that there is a power struggle between the parents and the resulting dominance of one parent. The other parent also considered dependent and weak during this time. Expressed emotion. Expressed emotion also called as is a characteristic of family environment, also called as emotional expression of family members. What are the components seen in the expressed emotion? Critical comments, hostility, and emotional overwhelmment. These are the negative expressed emotions, and positively warmth and positive regard is the positive expressed emotion. What are the assessment we can do in the understanding the expressed emotion, like Camberwell family interview and 5-minute speech sample, and other types also we can use in the assessing the expressed emotions. And communication enhancements, here you can see in the 4 areas, like active listening, delivering positive feedback, delivering negative feedback, and requesting to changes in other family members' behavior. There is a study, Big et al. Made of 1987, says that there is a cultural variances seen in the between using the expressed emotion among the schizophrenic patients compared to the like Western studies, Denmark and UK. There is a factor also sees in different outcome, and also expressed emotion is associated with higher levels of burden of care and with worse perception of patient social functioning. If changes in expressed emotion also there is it will affect also the patient burden of care. It was said by Cooper et al. In the year of 1998. Social drift theory. The drift theory came from the study done by Ian Goldberg and S.L. Morrison, looked at the relationship between schizophrenia and social class. Drift hypothesis, also called as undermine hypothesis, is concerning between the mental illness and the social class. The circumstances of one social class do not cause onset of a mental disorder, but rather an individual deteriorating mental health accused, first resulting in low social class attainment. In schizophrenia, where selection evidence is strongest, also factors may also be operating. Social selection and causation hypothesis is a subtype of social drift theory. It says that people of lower social status face more adversities and stressful events than upper class people. Mostly applicable to schizophrenia, also defined on the basis of income, education, occupation, and residence. The social selection perspective suggests that schizophrenia are overrepresented in the lower socioeconomic strata as a consequence of the impaired social mobility. There is a selection process would likely to operate both within and across generations. Breeder hypothesis. It says that when the child born, also the problem also started. Like risk increased with the increasing level of deprivation at birth. Subjects whose fathers were social class 4 and 5 or who were born in deprived areas were at increased risk of schizophrenia. The cultural disintegration hypothesis. Here, this theory also said that when some changes happening in the society, the problem also make more vulnerable to the patients. Example, the COVID-19 is a pandemic, also the great example for the psychiatric patients, according to this theory. To promulgate that social changes occurred by the events like disaster, extensive and widespread poverty, extensive migration or widespread illness, existing culture of the society leads to changes in the social formation. And also there is a social problem such as broken homes. When there is a family, the family has function and structure. So if there any changes between happen, the family called broken homes. So high rates of crime happening in the society and delinquency, the fragmentation of communications networks and widespread delinquencies also related to this theory. All of these changes are associated with cultural disintegration or a breakdown in the cultural capacity to function as an adaptive resource for the individual as well as institutions. Stress-diathesis model is also the important model related to schizophrenia. This model is predicts the predisposing, precipitating, perpetuating factors where is lead to the illness to the patients. The model predicts that a person is more likely to suffer an illness if he or she has a particular vulnerability or susceptibility and is under a high level of stress. There is a factors like a family history of substance abuse or mental illness, individual psychological characteristics such as hostility, impulsivity, biological characteristics, example cardiovascular reactivity, hypothalamic pituitary adrenal responsivity, and environmental changes such as childhood maltreatment or low socio-economic status also related to this model. The George Angel also said that the biopsychosocial aspect related to this model, without stress happen, they also patient also function normally. Labeling theory. Labeling theory also is very important in the sociological aspect as well as related to the schizophrenia. It was developed by Howard Saul Beckers. during the 1960s. The labeling theory, emerged from the Western world, during that time also the sociologists also against to do the psychiatric diagnosis, psychiatric treatment, as well as institutionalization, as well as they are very like opposite to the IQ test or the other psychological assessments also according to this theory, because they are labeling someone, etc. So labeling theory holds that abnormal behavior is not inherent, but it has social consequences. Everyone does some abnormal behavior in their lifetime, but society labels few persons as mentally ill, sick, abnormal, and so on. This type of label or tag powerfully changed the person's self-concept and his self-identity, as well as social identity. Structural strain theory. The structural strain theory has emerged from the delinquent behavior. This theory is related to the schizophrenia as well as antisocial personality disorder. The theory postulated by the American sociologist Robert K. Maternal. This theory mainly concerned with the deviant behavior thought it is helpful in shedding light on individuals' mental illness. The explanation of the deviance phenomenon offered by Maternal is mainly focused on such concepts as institutional norms, cultural goals, prescribed and proscribed behaviors, and anomaly. So when the anomaly behavior, like there is they were not accepting the cultural behaviors, norms, rules, during this delinquent behavior, the structural theory leads to the illness. In the unequal society, the strains between socially approved goal and individual ability lead to deviant behavior. Bowen's theory, family systems theory, was developed by psychiatrist and researcher Dr. Murray Bowen. This is a very famous theory. In the recent years, Bowen's concept of self-differentiation describes different levels of maturity in relationship. And also triangulation, where is the parent, like father, mother, children, when the parent has conflict between them, one parent directly go to the children and not consider to the other parent. This is examples of triangulation and differentiation of self. Also, there is a described levels of maturity relationship happening in between them, and a nuclear family emotional system related to the what are the family expression also decrease, like undermine and upper mind, and family projection process, multi-generation transmission process, like when there is anxiety in psychiatric history, family history of anxiety, family history of bipolar disorder, also they shared it to the other generation, like it also said by Bowen in the theory of multi-generation transmission process. And the emotional cutoff, there is one person not emotionally shared a reciprocal relationship to others, and the sibling position, when there is one sibling born, when there is second child born, the sibling position also started in the family, like the sibling also competed with other sibling, always has jealous and the conflicts between the towards the other sibling, and the societal emotional process. When there is a society that also influences in family also influencing society. So when there is anxiety happen in the society, it also influencing the family also influencing the individual. So individual is more vulnerable to the developing the diseases. In conclusion, there are evidences which showed that schizophrenia has psychological, psychosocial, etiological factors, and there are so many social factors which can promote to develop person's psychological disorder, because individuals are interrelated with those factors. By the time period, those factors are changing and their role also changing. Various social factors also interrelated to each other and they influenced by each other. That's why it is difficult to identify a single factor as etiological factor of a particular disorder. Thank you all. Thank you. These are my differences.
Dr. Srinivasan. Can I request others to pitch in with their comments or any clarifications? I think the psychology students have also joined us. Any clarifications on any other theories, any other aspects? uh, Srinivasan, can you explain what is a family system? A very basic question, is it? It is.
Sir, family system is when there is a like there is a what can I say, there is a structure and family functions, and also there is a subtypes in the system also. When there is a like we can say related to the like blood relations, his own family, and other relations like in neighbors and relatives in the other circle of the family system. So these are the other like the patient also when there is the family members using other related aspects like hospital and other areas, schools. It is also the part of the system in the family, sir.
Okay, I think it is important for us to understand these derivations which are used to importantly explain the origin of this schizophrenia process. This is that fits into biopsychosocial model. So biological, we have not talked about the psychosocial model. These are theories. These are not. These are just mere assumptions which have been tested, I suppose, by some of the authors. An important one for postgraduates here, exam going postgraduates here is, I hope that all the exam going students have joined this presentation because it is very important. Like schism and skew, double mind, schizophrenic for mother, then pseudo hostility and uh, then when he described these family systems theory, Bowen's theory, so these all have to be actually, they may be asked in theory or in practicals. And importantly, it helps us to understand how family dynamics goes through. Express emotions, we have already had one separate presentation on that. So if any questions or comments from the faculty?
Yes, I would just like to add, yes, to Dr. Shobit, that these are theories. So please don't be overzealous in implying them. For example, in the past, many patients.
Sir, you're not audible.
Hello, can you hear me?
Yes, sir. Yes.
Okay, so these are like theories, and these are not explanations or facts. In the search of etiology of schizophrenia, many factors were searched for. Family factors is one of them. And in the past, like many patients have been stigmatized, like schizophrenic mothers. So while we are taking this history, we should take care that we don't, focus only on the negative aspect, also on the protective factors of the family. They are there. So what information you get depends on what questions you ask. If you are only asking for the flaws in family, then it may also, we can say, affect the rapport with the family, with the caregiver. So you have to be a little bit careful in taking family history to get the whole picture. So that is my comment. And this is a very important topic, I think, well presented by Srinivasan. And you can expect a short note on any of these topics like schism theory or double blind theory in your exam. So it is important from that aspect also. Thank you.
Dr. Shobit, I would like to, say a few things about today's session. I do agree with Dr. Mohan Dhyani, sir, because these theories, they just give us basic understanding of the etiological factors, the reasons behind any mental illness or any psychiatric condition. But apart from this, whenever we are planning any therapy or any family therapy for that matter, we need to have a proper tailor-made understanding of the whole aspect, depending upon cultural background, social background, and everything. So yes, we should take these theories into consideration, but at the same time, we should also have our clinical understanding of how to go about the situations or the conditions, and how to help the patient and the family members at the best. Dr. Srinivasan has done a very good job with today's topic. So thank you from my side. Yeah.
Thank you, ma'am.
Srinivasan, we would also appreciate that you can bring up some more examples to explain, like schism and skew, double bind, so it was more forthcoming, and maybe also teach us in future with more presentations, because this domain is very important, because no patient is a patient without a family. So family dynamics to understand, it starts and ends at nowhere. So there is no limits to it. So probably we'll learn more from you, from your side. Thank you for your presentation.
Thank you, sir. Thank you all.
So if there are no questions and comments, we're ending the meeting. I think host can end the meeting.